Hi everybody, Big Papa Scott here again. Thought we'd try to explain atrial fibrillation today. It's also known as a-fib. I'm seeing a lot of commercials on TV for medications that help treat a-fib. They're mainly blood thinners, and I'll explain to you why a blood thinner is needed when you're in atrial fibrillation. But first I want to explain exactly what atrial fibrillation is, and first we'll start with how the normal heart beats, and then I'll show you how it beats when the person is in atrial fibrillation. So here's a drawing of the heart with the electrical or the nerve endings in it that help keep the heart beating. Every heart is not exactly the same, but it's pretty close. So there's different what they call nodes. So there's a sinus node, an atrioventricular node, and I'll explain this thing here is called the bundle of His. Don't ask me why, can't remember, too old. And then we have these nerve endings that go around here, and these are called the Purkinje fibers. I'm assuming there was a doctor named Purkinje who found them, I'm not sure. But that's basically how the heart is laid out in its electrical activity or electrical base. So I'll give you an idea of exactly what happens when the heart beats. So when the heart beats, everything starts with this node here, this sinus node. It is the generator, the originator of the heartbeat, the normal heartbeat. And when it fires, it sends a signal that goes all the way over here to the left atrium, and then through several areas in the right atrium, and at the bottom of the right atrium somewhere is the AV node. And this is kind of a holding area for the signal, and what it does is kind of holds on to that signal for not a couple of seconds, but for a couple of milliseconds until all the blood is in the ventricle, and then it sends it to the bundle of His, which is right here, and then that is sent down these Purkinje fibers, and the heart contracts. So the heart squeezes, and the blood is pushed out, and the whole thing starts over again. So the sinus node fires again, and then it goes down to the atrioventricular node through these little pathways, and over to the left atrium through these pathways, and then to the AV node where it's kind of held up for a millisecond or two, and then sent right to the AV node, the bundle of His, and then through the Purkinje fibers, and you've got a second beat. And this happens in most people 60 to 100 times a minute. That's the average, 60 to 100 beats per minute. Some people have a naturally higher heart rate. Some people have a naturally lower heart rate, especially patients who are in incredibly good shape, like myself. No, I am so lying. They might have a resting heart rate in the upper 40s or lower 50s, and I've seen actually heart rates on Holter monitors, which is another testing method we use. It records the heartbeat for 24 hours. Most people with atrial fib will have that done too. But I've seen rates on people like triathletes drop into the 30s. And usually if it was an older person who was just laying in bed and dropped into the 30s, you'd be taking him over to the pacemaker lab to put in a new pacemaker. But if the person's in really good physical condition, obviously, their heart is so efficient that they don't need it to beat as often as most other people do. I'm one of the people who's closer to the 100 beats a minute, unfortunately, but I've always had a higher heart rate, even when I was a kid, so I don't know what it is, but that's what my heart is set to, so that's what it does. But anywhere from 60 to 100 is pretty normal. So, okay, so here on the right we have a representation of a heartbeat. It has different components to it, as you can see: a P wave, Q wave, R wave, S wave, and a T wave. This makes up the actual beat of the heart. So when you see one of those, that is equal to one beat. That's one of the reasons why I get so mad at medical shows, is sometimes they don't even show this as a real heart rate. They just kind of throw in what looks like some significantly bad rate for no reason at all. But that's another time and message. Forget it. I'm sorry I even went there. But to show you how things coincide, the sinus node right here is representative of the P wave. And then the AV node is representative of this area right here where there's a little bit of waiting time. And then the bundle of His is the start of the EKG here. And then the rest of it, the Purkinje fibers and everything, is the rest of the EKG, the whole lot of it. And the T wave here is basically when the heart recharges its generator and gets ready to start the whole process over again. So the reason why I point this out is because in some people that have atrial fibrillation, there's an interesting thing that happens to their EKG, and I'll show you in just a second. So people in atrial fibrillation usually have a very bad problem with the sinus node. So that's this node here. And what happens is either it stops working, or it kind of doesn't work right, or there are stronger signals coming from other parts of the two atrium that override the sinus node and make it ineffective. And what these beats do, let's say one originates from here, maybe one originates from right here, or over here, maybe one originates from here. There could be 4, 5, 6, there could be a ton of those basically in the atriums that are firing a signal off that is going all to the same place, the AV node. But you can see that each one of them has a different amount of distance that it has to travel to get to that AV node. And what that does is it makes the heart rate irregular. So you might have a P wave, a T wave, and then at the T wave, all of a sudden, you might have another P, and then a QRS, and another T, and then there might be a pause, and then another QRS. And the reason why there's a pause is it may be coming from this one. And that's much more distant than one of these two, let's say. And so sometimes when it fires real close to the AV node, you'll get a faster heart rate. And if there's a distance, you'll get a slower heart rate. So, anyways, that's kind of a quick and dirty explanation of that. But what happens is the ventricle will contract anytime the AV node will send a signal down to the bundle of His, the top part of the contraction center of the heart. So as this contracts and you see these heartbeats, all this occurs just a little bit before the heartbeat, but you don't really need to know that. This is just the electrical signal. The contraction actually probably takes place right here, somewhere in that vicinity. But anyhow, the thing with atrial fib is because you have so many places that could be firing signals, this EKG will be very irregular. And you'll see one P wave that looks like this, and you may see another P wave that looks pointy. You could see another P wave really close to the QRS. you may not see much of a P wave at all. You might just see kind of swiggly lines here, and that's just a sign that there's so many firing that they're all trying to get across, and maybe one escapes and gets through. So atrial fibrillation is dangerous because when there is a normal contraction of the heart, hold on a second, sorry about that. So when there's a normal contraction of the heart, the atriums actually will contract. Now they don't contract a lot, but they contract a little, not as much as this big muscle of the ventricle, but they do squeeze. So there's a little bit of a squeeze that goes in to the atriums when they contract, and that helps push the blood down into the heart. And that little bit of a contraction is important because that clears the upper chambers of any blood. Okay? So, why is atrial fib dangerous? Well, there's a thing, and I'm not sure exactly where to draw it because I've only seen it on the use of the heart, but there's a thing called an atrial appendage, which is a little outcropping of the atrium. They don't show it here, but it's in the left atrium usually. There is a right atrial appendage, but it's not as big. The left atrial appendage sticks out right here, and it's a little, almost a little chamber by itself. And what'll happen is, if there's this chaotic firing of signals, then there's no real contraction of the atriums. And what can happen is you get stagnant blood in the atriums a lot of times. And that stagnant blood really pools in the left atrial appendage right here. So the left atrial appendage will sometimes form a blood clot because the blood is just not circulating well in there. And that blood clot obviously is very dangerous because if that breaks loose, that will go down into the left ventricle, out the aorta, and it'll probably go up to the brain and cause a stroke. Now, depending upon the size of these blood clots, they can be very, very dangerous. So the reason why we put people on blood thinners, and they can be the ones that you see on TV, the commercials, which we see on TV all the time. I can't even remember the names of them right now, but they used to use a drug called Coumadin. I'm not sure if that's how you spell it, but Coumadin was the main blood thinner that was used for years and years and years. But the problem with it is you have to get a blood test every month, and they have to regulate your dose to make sure it's right, and make sure that there's the correct amount of blood thinner in your body. These new ones that have come out, there's no need to have a blood stick, or a blood draw every month. They somehow work very well and actually thin the blood without having to monitor it. So that's the reason why patients on atrial fib are on a blood thinner. And the blood thinner will help prevent those clots from forming like I showed you before. Sometimes a clot can even be up here or somewhere up here, but it depends. And most of the time it'll be in the appendage, and that's why they want to thin the blood. So a blood thinner will, sorry, wrong one. The blood thinner will help take out that clot by thinning the blood. So the clots will be removed, and the person can live a pretty normal life with atrial fibrillation. So that's the story on atrial fib. I thought I'd let you know. If you have any questions or comments, please leave them in the comments below. I'll try to answer everything if I can. And I hope that helped. Have a great day. Bye.